Complex Wound Care. I am Kathleen Elliott, nurse with Evergreen Life Services. This training was created to address Evergreen Life Services policy regarding complex wound care, including how to properly document that care. There is no simple definition of what constitutes a complex wound, but in practice, the term tends to refer to wounds with one or more complicating factors, such as exudate, infection, comorbidity, and polypharmacy. Examples of complex wounds are diabetic leg-foot ulcers, pressure injuries, chronic venous ulcers, infected wounds, and those related to vasculitis and immunosuppressive therapy that have not healed using simple care. Surgical site wounds can also be considered complex. While all wounds are of a concern, a wound that is identified by one of these terms is considered a complex wound by definition and has specific care requirements. After reviewing documentation from the medical provider and assessing the wound, the RN communicates the nature of the wound to the care team. The RN, assisted by all of the care team, including the medical providers, LPNs, home staff, family, and client together, determine how to best provide the level of service the client requires. It is the nurse's responsibility to train home staff regarding the care of any wound. It is the home staff's responsibility to make sure they know how to care for the wound, monitor the client's health status, and to report changes in the health status of the client to the nurse. Complex wounds require regular evaluations by both home staff and the nurse. Complex wounds require regular evaluations by a trained medical provider. Wounds are periodically evaluated per the medical provider's schedule until healed. Complex wounds require monitoring the overall state of well-being. Any changes in the overall health status, abnormal vitals, and wound changes are reported to the home manager, nurse, and medical providers as needed. Wound care instructions come from the medical provider, which may be a wound care nurse specialist, to Evergreen Life Services staff. The instructions should be maintained in the patient's record and updated each time the medical care provider changes them. The Evergreen Life Service nurse will train Evergreen Life Service staff, including other nurses, on how to properly care for the wound. Complex wound care includes appropriate documentation of care provided by the nurse and other home staff. Instructions from the wound care provider should include a thorough description of the wound, i.e. the stage of the pressure injury, if the wound is a pressure injury, the size, which often uses a tape measure, depth, and overall appearance. This is done at the initial evaluation of the wound and at all subsequent visits in order to monitor the site for healing. You'll need all supplies necessary for wound care. You'll need specific instructions on how to care for the wound, the frequency of wound care, positioning cautions, pain control measures, and the frequency of the need to return to the wound care provider. Complete wound care includes appropriate documentation. If you have questions, ask the medical provider before you leave the appointment. It is appropriate to call the medical provider with questions and concerns. Talk with someone who can address your concerns and answer your questions. Ask the provider to fax the home clarifying instructions. Upload those instructions to Therap so everyone caring for the patient can access them. Call the nurse with any questions. Evergreen Life Services uses Therap as the EHR. RN, LPN complex wound care entries are documented at the initial assessment and then, at minimum, weekly. It is most helpful if these entries are documented under the Health Tracking module using the specific tab Skin Wounds. In fact, this tab will guide you through details required for an appropriate complete report. Staff and other nurse entries are documented at minimum daily under the Healthcare Tracking module T-Log. Share complex wound care. On the left-hand column are the nurse's responsibilities. On the right-hand column are the home staff's responsibilities. Going through the nurse responsibilities, weekly, the nurse will visually assess the wound. Compare with last week's assessment for worsening versus healing. They will weekly write a comprehensive wound care note in Therap. Again, if they use the Skin Wounds tab, it will guide you through exactly what you need in order to have a complete report. The nurse will weekly review a daily T-log entry by staff. The nurse will weekly check for attendance of all scheduled medical appointments, and they will assist staff in scheduling appointments as appropriate. The nurse will communicate with staff regarding the client's overall health status, and the nurse will call the medical provider with concerns. The home staff will do a daily visual assessment of the wound. They will call the nurse immediately with concerns. The home staff will daily enter one comprehensive T-log entry per day, including observations specific to the wound state. They will daily ensure all supplies, including medicines for wound care, are available in the home. They will attend all medical appointments, enter appointments into Therap, upload medical appointment documentation into Therap. They will schedule appointments as appropriate. The home staff will communicate all concerns immediately with the nurse, and they will call medical provider with concerns. You will always assess, document, and alert the nurse to any changes in the wound status, and the frequency of your documentation and assessments will depend on the individual circumstance and may be more frequent than the minimum requirements listed here. Always call 911 for immediate health threats. All wound care encounters must be documented. Formal medical provider appointments are entered and uploaded into Therap per policy. Nursing and/or home staff wound care, including wound inspections, are recorded in the MAR and in Therap as appropriate. Examples of how to document wound appearance are the type, such as a burn, cut, abrasion, blister, pressure injury; the appearance, such as healing, deep, shallow, shiny, dry; the color, such as pink, red, black; the size, such as the size of a nickel or with a tape measure 1 centimeter by 3 centimeters; the shape, which could be round, straight, with approximated edges or irregular, or extra factors like there are staples or stitches present. Again, if you use the Wound Skin tab in Therap, it will guide you through exactly what you need to say in order to have a complete report. Pictures of wounds, including rulers or other tape measuring devices, may be appropriate to document and upload into Therap. Documentation can be time-consuming, but with regular practice, it will become easier to know what you need to say to make the note complete and how to say it. Each entry, including that by home staff, will have different details. Some notes will be shorter than others, but the note should always have several sentences with good detail, a good description. Someone reading the note should have a good idea of how the wound looks and get a good sense of the overall condition of the client just by reading what you have written. This is an example of what could be written in the narrative portion of a complete note. Again, the Wound Skin tab in Therap can help guide you through the specifics. This is an example of nurse documentation. Last outpatient wound care appointment attended, Alexandria Outpatient Wound Care, 6/20/2022. Appointment paperwork was reviewed. No changes in care. Wound is noted as healing well. Home staff observed nurse providing wound care. Nurse verbalized wound care instructions to staff. Staff verbalized understanding of instructions. The staff notified wound care instructions available in Therap inpatient record. All questions answered. Continue to attend all medical appointments. Home staff instructed to call nurse versus 911 with concerns and questions. Wound is 2 centimeters by 1 centimeter by 1 millimeter, approximately the size of a quarter. No redness or purulence noted. Skin is dry and normal in appearance surrounding wound. Wound was cleaned with Hib Cleanse, rinsed thoroughly and patted dry, covered with island dressing, per provider instructions. Patient tolerated procedure well, all questions answered. Complex wound care that requires extensive dressing changes, packing, daily skilled nursing assessments, and daily complex interventions such as mechanical wound debridement, soaks, irrigation, whirlpool, packing, wound vacuum therapy, and/or complex dressing changes requiring sterile or aseptic technique must be reported to the home manager, QIDP, and executive director. A formal assessment should be made to address the appropriateness of the patient's current service plan. This video specifically addresses Louisiana State and Evergreen Life Service requirements for proper complex wound care and documentation. There may be elements that are applicable to other care settings. Information in this video needs to be corroborated with current standards and your entity's specific policies. Thank you for watching, and please like and feel free to leave questions and comments below.